Hi everyone and welcome to another Psych student video. Today we're talking about autism and learning disability. So firstly, when we think about autism, it's important to note that it isn't just singular autism we're considering, it's a spectrum of disorders. So whilst the most common one people are aware of is autism, the spectrum part is really important. And this spectrum is made up of a variety of different elements. So we might think about social interaction and communication, and these might be altered in different ways. Eye contact, for example, might be more difficult for someone with an autistic spectrum disorder, or there may be differences you might notice and pick up in body language. Sometimes people are particularly fixed in routines or in interests, and so disruption of that can be really difficult. And within autism and autistic spectrum disorders, it's really important to be aware of sensory sensitivity. And that's something that's less well known, but can make a really big difference when you're trying to support somebody. And you might notice as well some repetitive behaviours, but because it's a spectrum, some people may have difficulties in one area and not in others. Learning disability, however, is different to autism. It's really focused on learning. So you can have autism and a learning disability, but you equally could have them separate and they're not the same thing. So autism looks at those kind of features that we discussed a moment ago, whereas in learning disability, we're really looking at that IQ and that learning ability. There is kind of a way of assessing the severity, and they're grouped into kind of general categories of mild, moderate, severe and profound depending on IQ testing. Although for a lot of people it's quite difficult sometimes to access formal IQ testing, and you've got to be in a good place in terms of your mental health to go through that without it being impacted if there's other things going on. So that's of some use, particularly when we're thinking about the needs, and often the needs of a person will increase in terms of support needs as the severity of the learning disability increases. However, it's important not to assume what the needs of an individual are, because within this, people are going to have really different strengths and weaknesses. So I'm going to go through two different scenarios here because it illustrates a couple of really key points in helping you to support people who've got autism spectrum disorders or learning disability. And also we've got a lot of students that follow our kind of YouTube channel and Facebook, and these are common scenarios that could crop up in OSCE type examinations. So the first scenario we're thinking about is behaviour change. So this considers a person who perhaps has a learning disability and has kind of shown differences in increased self-harm, or they appear more distressed in whatever manner that individual expresses that. Or maybe their risk to others increases in terms of kind of aggressive type behaviours. It's really important, first of all, to figure out exactly what has gone on. So describing the situation that has kind of evolved. So is there a pattern of this new behaviour? Is it occurring at a time of day? How severe are the problems? Are there triggers? The timeline of things, when did those start? So getting a real idea of the chronology. And then we look at it in a biopsychosocial format. So the biological side, is there a physical illness that's underlying this? Sometimes if you are a person that is struggling to express yourself in a verbal manner, it might be that instead of a verbal manner, the distress manifests in different ways. And it's important to understand any biological factors for that. So maybe underlying this new distressing behaviour is constipation or a headache or some other kind of pain that is difficult for them to express. From a psychological side, we're thinking about, is there been a stressful events? Maybe there's a grief process, for example, going on, or some kind of psychiatric comorbidity, depression, anxiety, psychosis. Lots of things could still be occurring. And from the social side, has there been a change in carer or in some other manner of social support? Maybe the timings have changed, or there's been a change to the routine that they're used to having. Scenario 2 then, thinking about consent. So that could be consent for any kind of procedure, whether it's consent to have a blood test or a surgical operation, could be any kind of consent that you need in order to address treatment. And the main thing is to never assume that someone with ASD or LD can't give you consent and doesn't have capacity. So when we think about capacity, we're thinking about their ability to understand, retain the information, weigh up the information, and then communicate their decision back to you. And it's therefore important to assess their capacity in an appropriate way for that person. Otherwise, you're not assessing the capacity properly. It might be that they can communicate through kind of pictures or non-verbal manners. And so engaging with the person as much as possible, even if maybe they can't give you capacity for the full picture, they can still have some say over different things. And sometimes they might have kind of charts and cards. Maybe they can say, I'm in the red zone or the green zone, or they can communicate by pointing at pictures of the thing that they mean. So my top tips for you overall when trying to support somebody with ASD or LD is don't make any assumptions about what they can and can't do, and make sure that you give them the chance to contribute as much as possible to decisions about their care. Try and get all of the information, so from family, carers, pre-existing documentation about their wishes and interests, and engage the individual as much as possible using the appropriate communication strategies. And if you're not sure what those are, then ask the person, ask whoever's with them if they've got support, and use the MDT. So that might be occupational therapists and psychologists and other members of the team as well. I hope you found this video helpful. Thank you for watching.